Good day to Ms. Joy and my fellow peers. My name is Kam Eileen with ID number 9708155652540001. Currently, I'm pursuing a Bachelor of Nursing Science on semester 11, May 2025 in Open University Malaysia, Kelana Jaya or Petaling Jaya Learning Centre. I'm taking the subject NBNC 4302 Clinical Practice Study in Management, and today I would like to present the title of Reflect on Own Feeling and Thoughts about a Change Made by Organization and Examine own responses during this change. So let's move to the outline. First will be introduction. Second, understanding of organizational change. Third, exemplifying a change made by the organization. Fourth, reflecting on own feeling, thoughts, and response to the organizational change. Fifth, discussion on the strategy to be used to keep self-control with the process of organization change besides keeping self-motivated, reduce work stress, and enhance own performance. Six will be the conclusion, and lastly, the references. Let's move on to the first one, introduction. Organization change is an inevitable part of healthcare environment. It plays a crucial role in ensuring that hospital and clinical practices stay aligned with modern standard, technological advancement, and patient safety protocol. However, for healthcare professionals, especially nurses, adapting to change is often accompanied by stress, uncertainty, and resistance. This emotional and psychological response may affect motivation, work satisfaction, and the quality of patient care. In my own professional experience, I witnessed a significant organizational change in my hospital by introducing a new electronic medical record (EMR) system. This change was intended to enhance documentation accuracy and minimize contact with paper-based record to reduce the use of paper. While the change was timely and relevant, the rapid implementation and lack of training created a challenging working environment. Next, moving on to my next outline will be the understanding of organizational change. The goal of the change is often driven by the needs to improve efficiency, ensure patient safety, enhance service delivery, or comply with regulatory requirements in healthcare setting. It can involve modification to workflow, role, technology, system, or organizational culture. Nurses and healthcare staff are frequently at the forefront of this transformation, experiencing both the practical and emotional impact. Understanding how change functions in theory and practice is essential to manage its challenge and make the transition smoother for all involved. I would like to share one of the widely accepted module to explain the change of it, which is the Levin Change Management Module, according to Levin in 1947. It breaks down to the changing process into three phases: unfreezing phases, changing phases, and refreezing phases. The unfreezing phases involve recognizing the need for change and preparing individual and team by changing the status quo. The changing phases is when the new process or system are introduced and individuals begin to adopt new behavior or practices. The rephrasing phases is where the new state is solidified, making the change part of the organization culture. In nursing practice, these phases are crucial in ensuring that changes are implemented with minimal disruption and maximum acceptance. Another relevant module is Coded 8-Step Change module, according to Coded in 2012, which provides a detailed roadmap to managing successful change. It includes creating a sense of urgency, building a guiding coalition, forming a strategic vision, enlisting volunteers, removing barriers, generating short-term wins, sustaining acceleration, and anchoring change just into the culture. This model emphasizes leadership, communication, and staff engagement as central pillars of effective change. In my hospital setting, one of the major organization change was the upgrading of the existing EMR system, which revolutionized the way healthcare professionals deliver care. This comprehensive system enables nurses and doctors to order investigation digitally as well as to read real-time results and updates. It also supports tasks like booking appointment, reserving operation theatre slot, ordering specific diet, making referral to consultant, and retrieving patient historical record. This system streamlines multiple processes that were previously done manually or across fragmented platforms. In addition, improvement of the new EMR system was its interconnectivity across hospitals within the IHH group, allowing seamless access to patient data regardless of which hospital they previously admitted. This enhanced coordination between facility, reduced duplication of tests, and improved continuity of care, particularly for patients who frequently move between cities or require specific treatment. Despite the clear benefit of organization change like digital upgrades, such change are often met with resistance due to fear of unknown, lack of training, or fear of failure. For many nurses, especially those unfamiliar with digital system, the transition was stressful. Successful implementation of such a major change relies not only on the technical infrastructure, but also on how well staff are prepared, supported, and engaged throughout the process. By understanding that change can trigger anxiety, confusion, and performance issues, help leaders to plan more empathic and structured approach according to Macris and Houston in 2020. Hence, clear communication, realistic timelines, and opportunity for feedback are essential to promote acceptance and reduce resistance. By studying this theoretical framework and practice example, it becomes evident that managing organizational change in healthcare requires a balance of structure, sensitivity, and strategy to ensure both patient and staff benefit in long term. Moving on to my next outline, exemplifying a change made by the organization. A major organizational change took place at the Pearl Hospital where I work. The hospital transitioned from a semi-manual documentation process to a fully digitalized EMR system. This initiative was part of a large digital transformation effort aimed at improving workflow efficiency, enhance patient care, and minimizing the handling of physical documentation to reduce the use of paper. The new EMR system integrated a wide range of clinical and administrative functions. Nurses and other healthcare providers were now able to digitally order within a single platform. This upgrade significantly streamlined communication across departments and helped reduce documentation error, redundancy, and delay in patient care. So, what made the system even more impactful was its interconnectivity with other hospitals under the IHH healthcare group. This means that if a patient has previously seek treatment at another IHH hospital, their medical record could be retrieved instantly by authorized staff. This cross-hospital accessibility greatly improved continuity of care, especially for patients with chronic condition or those requiring referral to specialized center. It also reduced the need for repeating diagnostic tests to slowing costs and saving time. However, despite this long-term benefit, the implementation process presents numerous immediate challenges for the nursing team. The transition occurs during a high-stress period marked by when the high census, critically staffing shortage. Training for a new system was delivered online and was often rushed due to time constraint. During this period, I personally experienced anxiety and frustration. The pressure to learn a new system quickly while maintaining patient care standard was overwhelming. There were minimal technical support on site, particularly during night shift, and this created a sense of helplessness among staff. Reflect on this experience, it was clear that while the intention behind the change was forward-thinking, the appropriate lack of adequate preparation, pacing, and emotional consideration for the staff. According to McCarm, Parton, and Sibe in 2016, this experience taught me that the success of organizational change depends not only on technological readiness, but also on how the change communicated, implemented, and supported at the ground level. Next outline will be reflecting on own feeling, thoughts, and response to the organizational change. I felt overwhelmed, uncertain, and frustrated when implementation of the EMR system. When the training provided was limited, mostly conducted online, and lack of hands-on support that many of us. As some of us who value accuracy and timely patient care, I was anxious about feeling resistant to unfamiliar workflow and mentally exhausted by added the complexity in a high-stress clinical environment. Besides that, the system was also prone to technical issues such as printing or data not synchronized in real time, which led to delay in patient care. However, a turning point in my emotion and professional response came to a specific patient case that truly underscored the value of the EMR system. I would like to share an experience of my male patient from Penang was admitted to my hospital in KL during a short vacation. He arrived at the emergency department with worsening shortness of breath, generalized lethargic, and significant pedal edema. Upon assessment, it became clear that the patient was disorientated and unable to record much of his medical history. His family who accompanied him were unaware of his health background as he had apparently defaulted on his previous treatment and had not shared his condition with them. We were faced with the challenge initiating treatment without knowing the underlying condition and past medical history. This could have led us to delay or potentially appropriate intervention. Fortunately, because of the hospital where he had previously treatment in Penang was also part of the IHH healthcare group, we were able to trace his clinic data through a newly implemented EMR system. Within minutes, we were able to access his prior record, including an echo finding, blood test result, and imaging report. It turned out that the patient has history of congenital heart failure with reduced ejection fraction and had been previously admitted multiple times for failed overload. Armed with this knowledge, we were able to prompt initiated targeted directed therapy, monitor progress continuously, and involve the cardiac team immediately. The patient responded well to the treatment and was later transferred in a stable condition. This case highlighted the importance of shared digital information, particularly in improving patient safety and continuation of care. That incident dramatically altered my view of the organization change. I moved from a place of frustration and doubt to one of the appreciation and confidence. It was at the moment that I realized that EMR system was not merely a digital tool, it was an enabler of safer, faster, and more accurate clinical decision. The experience also instilled a sense of humility as I understood the change, while uncomfortable at first, often bring long-term benefit when embraced with an open mind. This transition helped me grow both personally and professionally. I learned the value of adaptability, collaboration, emotional intelligence, and continuous learning. Most important, I came to understand the meaningful change of involved short-term discomfort in exchange for a long-term impact and improvement in patient care quality. Next one will be discussion on the strategy to be used to keep staff comfortable with the process of organizational change, besides keeping staff motivated, reduce work stress, and perf- enhance own performance. The first and most important strategy during the implementation of the new MR system in my hospital was building peer support network. We began from informal peer group to support each other by troubleshoot system issue together and offer encouragement. Next is engaging self-directed learning. I watch tutor reader, read manual, and practice MR system during quieter hours. Furthermore, open communication with leadership was another crucial factor. I discussed and expressed my feeling and concern to my supervisor, hope that there's a super user in each shift so that he or she can guide us during the shift time in order to have a new smooth and prevent errors and have a safe workplace. To manage the emotional and psychological fatigue of change, I adopt serious stress reduction techniques such as deep breathing exercise, maintaining a healthy lifestyle, and to avoid burnout. Maintaining a positive mindset was another transformative strategy. Initially, I viewed the EMI system as inconvenient, but gradually I began to see it as a opportunity for professional growth. Moreover, presence of transformation leadership make a significant difference. Our ward manager encourage and empathy help maintain morale and reduce resistance to change among staff. Lastly, effective time management and task prioritize help me to stay organized and efficient during the change. I learned to group smaller documented tasks together and avoid unnecessary multitasking, which reduce my workload and allow me to concentrate on learning and adapting to the new system. Lastly, conclusion. Organization change is a consistent and necessary part of the healthcare environment, where innovation, patient safety, and system improvement are ongoing priorities. Initially, the shift to the EMR system brought feeling of stress, confusion, and resistance, particularly due to an inadequate training and the increasing workload during a period of highlighted patient admission. However, the transformation became easier as I connect with peers for mutual support, adopt self-directed learning method, this emotional resilience and communicated constructively with leadership. The role of leadership and organizational culture was critically supported, and empathic leaders were instrumental in creating a safe place where staff felt empowered to learn, share, and adapt. Their influence helped me develop greater confidence and resilience, trait that I will carry forward in future change and challenges. Lastly, the journey through organization change, through initially uncomfortable, became one of the most rewarding learning experience of my nursing career. These are my references. Thank you. I apologize that my background now noise is quite noisy. Thank you for your time.